And for someone who is in the medical field, aren't you concerned that, we could be facing a crisis of, a shortage of hands in the medical field as we progress?
No, I'm not concerned at all. I'm not worried.
You're not?
We have surplus. If you have surplus, you export. Yes. It happened at one time. Indian teachers. I was taught biology and chemistry by Indian teachers in my secondary school days. They are surplus in their country. We have surplus in the medical profession. I can tell you. It's my area.
This is where we're complaining that we don't have enough doctors to man.
Who said?
Rural areas. There is not enough medical professionals. You say we have surplus?
We have enough. We have more than enough.
That was probably the hottest topic of the week, and the fire is still burning pretty much. Nigerians watched that interview, of course, on Channels Television, Sunrise Daily by Maokwe Ogun Yusuf, and it was quite a shocker to a lot of people. And I have here with me Dr. Ololade Dia to help me understand, a lot of what a fellow medical practitioner, or maybe a former practitioner, and a minister of the federal government meant by his words. Thanks for being here today.
Thank you very much.
So many figures have been bandied around, about how many doctors we have in the country, how many are fleeing the country. You are a doctor. Hearing what the minister there said, for starters, were you as shocked as most Nigerians were? Did you think he was making sense?
Okay. Firstly, no disrespect to Honorable Minister, but I would like to say one thing. He has a point. Now, if you say we are surplus, I don't think there are appropriate figures. Now, the Medical Intensive Council of Nigeria actually was instituted in 1963. We've produced about 72,000 doctors since then.
How many?
72,000 doctors.
72,000?
Yes. So my father was a doctor. My mother was a nurse. My elder sister is a doctor. My younger brother is a doctor. Now, it's not a family of doctors. We're a lot. I think we're a lot.
Yeah.
So if he says that we are surplus, I will not agree with him, because I can remember clearly that minister is actually a doctor. Yeah, went to UNN, if I'm correct. Finished, I think, 1979, and he got into civil service. Now, some 2,000 doctors produced from 1963 till date, and I think an eighth of those 2,000 doctors are dead. But my father is late now. They are late. More than half have moved out of country for one reason or the other. So now we have about 35, 36-ish thousand doctors currently practicing in the country, both at primary health level and specialist care. So I think what
for almost 200 million people.
Yes, for almost 200 million people. That's about one doctor to 7,000 people.
Yeah.
Yeah.
Do you think that was a political statement, sort of a way to deflect the conversation, sort of defend government, or did he even need to say that? Because it was a problem that every Nigerian, I mean, you don't even need to be a doctor to know this. We go to hospitals, we've seen all of these figures that are about one doctor to over 6,000 Nigerians, and we know what the UN figures, the ratio is supposed to be. The World Health Organization, I think, says about 1 to about 500 or so, I'm not sure. So we know this thing. So where do you think that came from?
So I don't think it's, well, I'm not a politician,
yes,
so I will not be able to say if it's political, but I don't think there was any reason to have answered that way.
Yeah.
I don't even know why they asked him. He had never practiced medicine. I don't think he ever practiced medicine. Yeah, no disrespect, but I don't think it's a statement that he should have made.
Yeah.
He should have actually gotten the facts right before he said anything like that.
There's a theory apparently that he also had, saying that some of them are going out to get training and come back.
Okay.
If we had all of our doctors back in the country, do we still have a surplus, is what I even want to understand.
Okay, so
assuming they are just going to learn and come back.
For us to meet the global health requirement, we will need at least, as at now, 200,000 doctors. We have only 30, 35, 36,000. So even if they go abroad and go and learn whatever it is they want to learn and come back, it's going to be difficult.
Yeah.
Because now nobody wants to go abroad, see that there's a better work environment, the
And still come
Salaries
back.
are beautiful. There's water, there's light, there's transportation, health service for your children, job security for you. Who will leave that and come back here? Nobody will do that.
Yeah.
Those who have made money and want to come back, even have it, they find it very difficult.
So why are people like you still here? I'm not saying you should go, but what is the incentive?
I'm planning to go actually.
No, you're not. We're not going to let you go. But what's the incentive for people to still stay back? And it's something that Nigerians need, and it worries a lot of people. We don't have enough doctors even being churned out from universities now. We don't have enough staying back. You know, are we in a crisis? You think?
Okay. Firstly, I think I would state it clearly now that we're in a crisis. The healthcare system in Nigeria is in. I don't want to sound
Morbid.
too, yeah, exactly morbid, but I think we're in a huge crisis because right now, the thing is, whether we like it or not, if you go and you come back, you will face some challenges that everybody was going to face. Now, medicine for me is a noble profession. That's what it has always been, yeah? And passion with medicine is what drives most people that are here. I can tell you for free that there are people who started medical school, and after a while, I realized that most of them were even studying medicine or became doctors because their fathers or their parents wanted them to, or even wanted them to be doctors.
Not because they wanted
not because they wanted to. And they now go out and find their own real passion. Now, I started medical school with we were 300 in the class, but I graduated with we were 50 who graduated. Some of them went to microbiology, some went to biochemistry, some just left, changed computer science entirely. So I think it has to do with passion. Now, let me answer your question about why I'm still here. It's a tough one, yeah, because I actually plan to leave. That was when I finished medical school, I did my internship. I wanted to get into residency. I didn't like the way they were doing the residency here. So I said, okay, fine, let me go to Australia, very far away, nobody can reach me, and try and build something for myself. And, well, I will not say it's spiritual, I will not say it's God, but something just kept me here. And now the thing is, there are doctors in America, there are doctors in the UK, there are doctors in Canada, there are doctors in Qatar who are doing what they need to do over there. Here, we need the doctors. That's why I decided to stay. It's a personal decision. It's a personal decision. Now, my wife is not very happy with it because I had a lot of opportunities. I had an opportunity in Qatar, I had an opportunity in Dubai, I had one in Canada, but I'm still trying to, nobody knows what is what, so we're just trying to put it together. I just started practice. It's a hospital, it's not a hospital. It's a clinic that provides first-class primary health care services to people who can afford it. Now, to summarize that, there are four quadruple aims of healthcare. One, the patient needs to be satisfied. Two, the doctor needs to be satisfied. Three, there need to be better outcomes. And four, it has to be affordable healthcare. That all those things are not where they ought to be right now in the health in Nigeria.
So basically, from what you're saying, we don't have surplus doctors. People who are still in Nigeria are here mostly because they want to, not because they can't leave. No,
now. So some of them are just doing it because they're trying to put food on the table. They're trying to fend for their families. And what's
the way out of this? I mean, I hear you saying we're in a crisis. Most of us know we're in a crisis. I mean, the healthcare system in Nigeria is almost non-existent, to be honest. What's the way out, if you can, very quickly? Okay, so now what I will advise anybody to do, especially the populace, is, first of all, we need to be informed. Information is very key because there are little things that need to be done that people are not doing. Secondly, the government needs to be involved, whether we like it or not. Let me just give you an example. Your Obamacare is about 20,000 pages. I read 826. The Trump Care is about 126 pages. I read it 3 times. The budget for Norway for healthcare, as I heard, will fund NASA projects for 2 years, that's in billions of euros. Yeah, I don't know what our budget for healthcare is. Yeah, but I'm sure it's appalling. Medical schools in Nigeria are not even producing enough. So you need to encourage people to, if you want them to stay, get in a small apartment, give somebody a car. How it was when my dad graduated was, I think it was easier. I think they gave him an apartment, they gave him a car, he had phone loan. So we need more incentives to encourage people to get into the medical profession.
That's it.
And it has to happen that way. Well, it's a conversation that we'll have to keep having, hopefully better conversations that we'd heard from the minister there, because, I mean, we're in a crisis, and I believe you, and I really hope that we do sit up, and I mean, the president has 4 more years to hopefully start switching things up.
Yeah.
Thanks a lot for being here today.
Welcome,
Please
sir.
don't go away. Please,
You're welcome,
we need
sir.
you in Nigeria. We won't let you run. But like I always say, you can follow the conversation on Twitter at WhyNigerTV is the handle. The hashtag to follow is Robin Minds. You can also visit our website, whyniger.tv. Thanks for joining us. I'll see you next time.